I don't need to belabor sort of how COVID has impacted our communities in this debate around, if we should reopen schools, and if so, what that looks like, and who is going to be given priorities, how we begin to stagger. I mean, that's a larger conversation that will continue to play out. And I think it should not be one that is a one-size-fits-all approach. I think it needs to be based on a district by district sort of decision-making processes, because every district has its own unique challenges. But the three things I really want to sort of stress is that as we reopen, and whatever the reopening looks like, I just think that item number one that needs to be so much a part of this conversation, especially in communities of color, are the issues around social-emotional wellness of where students are in this moment.
Thinking about March, our schools closed here March 13th. All the way to June was when some of our students got laptops or got tablets in their homes to do work. And then they were rushed to do this work, just like hurry up and do the work and we'll give you a pass or no pass grade, right? And so how does that look for a kid who's trying to learn something and they've gotten 60 documents, or you have 60 documents and it's expected to be turned in 30 days, and they have no instructor online to do that work with them?
Because in the past, campus never be safe. Before the pandemic, the district or the education system never protect our students or our campus. So when I have a meeting with the superintendent, I ask the question, how you control these barriers that is not, you cannot see it if you never control what you see. What does that mean? And schools, we have fighting, bullying, kids bring drugs, kids bring guns or whatever, fightings. So our campus not safe, not before, now, and ever. So if we reopen the school, the district is not ready.
I think we need more data on AAPI communities, right? If not, I think the marginalized AAPI youth will not be part of policy, will not be part of practice. They won't be part of these interventions that we're discussing, and they will be rendered invisible. Okay. If the transmission is low amongst children, what does this mean for youth who live with grandparents or others who are at high risk, right? Even if you're saying that it's very low in terms of the transmission rate, I suspect that there still is concern that if they're living with a grandparent who's 70 or 80 years old and they aren't vaccinated by that time, what does that mean for them?
Well, there are numerous obstacles which many of you are familiar with, but when you add it up, it is quite daunting. I mean, for one thing, right now we're in a situation where the pandemic is at extremely alarmingly high levels. It's looks like things in the last week or two have improved, but it's still at an incredibly high level. Deaths are at an incredibly high level. Those haven't really gone down. And so that gives a lot of people caution about, is this the right time to be sending kids back to school? When really we're supposed to be being super cautious ourselves in our own lives.